Focus on Wockhardt Hospital in particular, where a huge number of medical staff has been infected by COVID-19, and that has raised the alarm given the situation, given the fact that there is also now this issue of unavailability of PPE, the personal protective equipment for some of the nurses. So two major issues: one, the exposure of the nurses inadvertently that happened because of a patient, a 70-year-old patient that was admitted to this hospital, and second issue is, of course, regarding the availability of protective gear. In fact, my colleague Disha is tracking this story. She will also tell us about the statement that has been released by the Wockhardt Hospital. So Disha is joining me live now. Disha, good morning. All the updates with regards to this particular hotspot. I believe Wockhardt Hospital has now been sealed. Nobody is allowed to enter this particular hospital. But give us the figures. How many nurses and doctors infected, and how did this happen? Is it because they were exposed to a COVID-19 patient, as is being reported? Okay, Disha will join us very shortly. But in terms of the information we have, the statement released by Wockhardt Hospital is accessed by Mirror now. As per that statement, on 17th of March, a 70-year-old patient was admitted for cardiac emergency. He did not, at that point of time, have any COVID-19 symptoms, which is why he was treated purely as a cardiac patient on the 17th of March. However, on the 26th of March, this particular elderly patient developed cough and tested positive for COVID-19. So were precautions taken in dealing with this patient between 17th to 26th of March? That remains to be seen. Or did this patient come in contact with a number of health workers who did not know that he could be a COVID-19 positive patient? Let me ask Disha these questions, and also about the statement released by the hospital as of now. Disha, the larger picture that we are getting is that the hospital staff in Wockhardt were unknowingly, inadvertently exposed to a COVID-19 positive patient. Can you take us through the information released by the hospital, the official statement by Wockhardt on this?
Well, definitely, Afrida. Till yesterday, we did not really know the source of the infection here, because here we are talking about a big number of healthcare, staff and professionals being infected with this COVID-19 is what we understand. 26 nurses and 3 doctors. In fact, the BMC had also set up a committee to probe this entire matter. And now, after the hospital has finally released a statement which essentially clears and gives the clarity about the source of the infection here in concern. The hospital says, and here I quote, that the source of the infection is identified as a 70-year-old patient who was admitted to the hospital on March 17th for a cardiac emergency. The patient did not show any symptoms of COVID-19 then. On March 26th, the patient developed cough and was tested for COVID-19, which turned out positive. The hospital staff were unknowingly exposed to the infection in the time period. So we are informing the healthcare sector at large not to be misled by asymptomatic patients. So here, of course, this is the statement that has been released by the hospital in concern, which confirms the fact that for over than a week, healthcare professionals, the staff here was in touch with the COVID-19 patient unknowingly, of course, because the patient was tested positive only on March 26th here in concern. However, on the ground level here, what we are getting to know is the fact, Afrida, at this point in time, the entire hospital has been sealed after numerous cases have come to rise from the same hospital. There are about 300 medical staff working in this hospital. 29 have been tested positive. The remaining 270 swabs have been sent for testing purposes. Nobody can be allowed to enter or exit the premises till the time they have been tested twice. So this is the kind of precautions that the government here is taking to ensure that people are safe and sound here. Especially at this time of the incident, during this entire period, there were 60 to 70 patients already admitted in the hospital for other treatment purposes.
Right.
So their tests were also done, and now what we are getting to know just as we speak, that their tests were being taken and all the reports have come out to be negative.